Heidi is a fraternal twin. She has a brother, Felix. They had some concerns about Heidi before she was born. She had an abnormal amount of fluid and they couldn't figure out why. So they scheduled her C-section for her safety. When she was born, everything was fine as they didn't find anything wrong. She was almost 3 weeks old. It was the middle of the day. I found her and she was blue. She hadn't been breathing. So she was treated and she started improving. She was discharged and we were back within 12 hours.
So from the first moment I met them, I really related to her as the parent of a young child as well about what they must be going through and how scary this must be. So you try to be as reassuring as possible and you reassure people that we're going to do everything we can to help you.
Even when I saw her pediatrician just yesterday, they said, it's crazy that we don't know what caused any of this. They think it could be because of her prematurity and just developmentally she wasn't ready to be kind of in the world.
We ended up putting in a very special feeding tube where formula actually goes directly into your small intestine instead of going into your stomach, and it prevented her from needing to have surgery to prevent the reflux from happening. We are some of the only doctors in the region who would be able to do this, and ultimately all the tubes ended up being able to be removed, and she's now eating everything by mouth, incredibly healthy.
The doctors and the nurses were great. They helped me to feel empowered to be my child's advocate, which felt awesome as a parent to know that there's somebody else supporting you in such a scary time.
There's so much work that it takes to make it work for Heidi, from nurses to home health to the inpatient pediatricians to all the other subspecialists that were involved. It really is a testament to the whole team here that helped to make things happen.
Knowing that she was well enough to bring her home and the problems weren't going to continue of her not breathing was amazing. It felt so good to have her home and the family be together.
We don't see cases like Heidi's very often where the events are so severe that they end up in the hospital. So these are the ones that you remember and you learn from. She's not even 2 years old. She graduated from the special feeding tube into the small intestine and then just the feeding tube into the stomach, and she's eating everything by mouth now. She doesn't even need to see me anymore.
Heidi has come so far in the last 6 months. She gets very hungry and she doesn't like to miss meals.